Me to share my screen. Okay. All right. Unfortunately, it's showing on both of my screens, so just give me one sec. All right, so here we go. Today's meeting is really exciting because one, we're talking about a brand new initiative. I say brand new. It's what we have as a state have committed to for the last 10 years, but now we have some funding to recommit to that over the next 5 years. So we'll talk about what we have titled Building Integration in Vermont's P3, so the prenatal to age 3 early childhood and maternal and child health systems. And it's funding through HRSA, but we're also going to dive into policy recommendations because we are at that time of year where the State Advisory Council will make recommendations that are printed in the How are Vermont's Young Children and Families report. And I'm going to skip that slide, although I do want to just quickly call out Amanda Biggs' really cute little girls who are starting kindergarten and 3rd grade. So Amanda was our coordinator in Chittenden, and she has moved on to an incredible librarian role that is the absolute best fit for her. So we're really excited and we miss her dearly. All right, so a quick reminder of the charge of our group, just as a level setting for anyone who hasn't traditionally been on the call. This group is really coming together to improve the integration and coordination of early childhood public and private partners who are committed to the health and well-being of kids and families. We'll be monitoring Goal 1 of Vermont's Early Childhood Action Plan, which is all children have a healthy start. And we're really trying to develop strategies and enhance the coordination to make sure that kids are healthy, thriving, and developmentally on track from the prenatal period through 3rd grade. And we'll talk more about how this group's work happens over the course of the next year and what that might look like under this HRSA grant. Largely we're talking about Goal 4 of the VCAP as well today, because the HRSA grant, or this VI3P project, will be focused on highest level early childhood systems and how we are integrating all of the different components of our system to support kids and families. And before I dive into the actual overview of this grant program, I just want to say that I have been speaking the praises of this child outcomes accountability team, not just in the state of Vermont, but nationally. Partners are recognizing the importance of our VCAP committees, but this one in particular is getting, I'll say, press, but people are really interested in the role of this group and how it was formed under our initial Act Early grant through CDC and AUCD, the Association of University Centers on Disability. So what's really exciting is we received 1 year of funding under AUCD to do a range of work in kind of resetting what previously was, Beth, you're going to have to help me with the name of this committee, Health and Wellness, the Early Childhood,
Early Childhood Wellness. Yep.
And so when we received this AUCD funding, we reset the charge and named it Child Outcomes Accountability Team to really be thinking about our updated charge under the VCAP. What is so exciting is that our partners at AUCD have recognized that there's something about the way this team comes together and the work that we do in Vermont that is unique and exciting, and they want to hear more about it, and potentially doing a case study to understand what about Vermont's early childhood system, what about this committee has been so powerful in coming together and aligning and integrating, because they have not seen this happen in the same way in other states. So that is something that I just wanted to say to this group as a big congratulations. I also have the jets flying over me, so if you're hearing them, I apologize. But it really is an honor to have AUCD and CDC say, Vermont's doing some amazing work. We want to understand more. We want to be promoting that, and we want to take some lessons learned for other states. I'm going to pause for just 1 second because of those jets. Okay, we'll see. We'll see if it continues. So, that is all to say that we had an incredible first year of funding from AUCD. They were really impressed with the work that Vermont did alongside, other states that received this funding, and they did offer another year, so a year 2 of funding from AUCD to continue the work of this committee. What's even more exciting is that Vermont was also awarded this 5-year grant from HRSA. And there were 12 or 13 other states that received both of those funding sources. And so now both HRSA and AUCD and CDC are trying to adjust work plans and figure out how to align both of these kind of resources and TA that's available to the state to align work plans and initiatives for the next couple of years. So more to come on how our funding from CDC will look and AUCD for the next year, but really excited to talk to you all about this new HRSA award that we're going to keep referring to as VIP3. I'm also wondering why your screen is not matching my screen in terms of the screen share.
How's that? Is that better?
Yep. Next slide. There we go. Thank you. Okay. We both shared the screen, which is why multiple screens going at the same time. We're not on the same one. Sorry about that. So let me give you a little bit of background about this HRSA opportunity. Again, it's really focused on integrating maternal and child health and early childhood systems in the state of Vermont and what that can look like. It's 5 years of funding. The total award is $766,000. And there are a range of different ways that funding is being used over the course of the 5 years. But we're really excited because this is the first time that Building Bright Futures and BDH have applied for this very large, I say large scope of work, limited amount of funding, federal grant that is really about supporting our systems over the next 5 years. And what's exciting is that this AUCD opportunity really set the tone and the stage for us to be able to receive this HRSA funding, which is amazing. So over the last year, we partnered with our partners at Maternal and Child Health to write this grant, and it will be co-led by Building Bright Futures and the State Advisory Council, as well as our maternal and child health partners at BDH. Next slide, please. The notice of award and the overall goal of this project, again, is really about strengthening systems. So goal for the VCAP. And I just want to flush out a little bit of these kind of 8 bullets here or 7 or 8 bullets for what they are asking us to do. So one of the first pieces of this grant is how do we build capacity and leadership in the early childhood system? How do we promote leadership opportunities? That may be professional development, but it also may be how are we building the next generation of leaders in Vermont's early childhood and maternal and child health systems? Another is conducting a systems asset and gap analysis. And you all are probably flagging the 5 to 8 early childhood and other needs assessments that we did in this past year. So we actually wrote into this grant that we've conducted at least 5 needs assessments in the last year. And the opportunity for this grant is to now look at those needs assessments that were all done in silos, right? So we had the McVie needs assessment, the early childhood needs assessment, the Head Start needs assessment. I'm just naming a few of those. Now the opportunity is to actually look across all of those and say, what do we know about the existing gaps and assets? How do we reduce areas of duplication through mapping our early childhood system with maternal and child health? For those of you who have been involved in the work of aligning early childhood and Medicaid, so the ASIM work, this will be that continuation where we will actually map from both a systems perspective, but also a funding perspective, what our systems look like in early childhood and maternal and child health. Another key component of this grant was, for this grant purpose, creating an early childhood strategic plan. In the state of Vermont, we already have one. We have a very strong Vermont Early Childhood Action Plan that was created in 2020. So what we proposed is the opportunity to strengthen the VCAP using an equity lens and aligning the VCAP with the maternal and child health strategic plans over the next 5 years to think about how we are collaborating and how we're aligning visioning, messaging, and communication. The next is around enhancing cross-sector collaboration and the use of high-quality data to inform policy. So really looking at the entire BBF network, all of the partners that are coming together in early childhood, and trying to identify where are their partners from maternal and child health, obstetrics, gynecology, pediatric health that aren't at the table. Where do we need to make sure that we're increasing the public health and pediatric health voice across our system. And how are we aligning our data initiatives through our data and evaluation committees by supporting the enhancement of the state longitudinal data system and this bigger vision for how we're kind of using data to inform decision making. Another key bucket of work for this grant is developing and implementing innovative financing, health, and equity strategies to improve policy, service provision, and outcomes for P3 kids and families. This one is really interesting. We're really focusing on developing an early childhood budget. And for those of you who have been in this network for much longer than I have, this is something that the BBF network is charged with doing in statute and hasn't been done probably in the last 5 years. So we have a template for an early childhood budget that has not been used in quite some time. So part of this grant will be to actually develop that budget, use that alongside the system's asset gap analysis and our strategic plans to say, what is the vision and how are we reducing duplication and how are we developing innovative financing strategies to support the work? Another key initiative that is very much so aligned with the work of the AUCD grant and what we as a BBF network have committed to in this next year is how we promote family leadership, partnership, and engagement. What does that look like? And how will we move that work forward? And again, this is a collaborative approach between a range of partners, including the Child Outcomes Accountability Team. And then the final piece of this is really around advancing equity in maternal and child health and early childhood systems and how we are operationalizing that as a system. And that one will be really interesting. And I'll talk about in the context of recommendations in a couple of minutes. So next slide, please. And I'll talk a little bit about the role specifically of Building Bright Futures in this project and then the role of this committee. So we are charged with conducting the asset and gap analysis. And what's exciting about that is we built money into the budget to actually have a contractor support that work, which is really exciting. So again, taking the work that was done under the Aligning Early Childhood Medicaid to support kind of the basis for that system's asset and gap analysis and early childhood mapping. We will also be partnering with a range of folks to support early childhood leadership. We will be, over the course of the 5 years, really looking at the VCAP from an equity lens, using the guiding principles to drive how we are talking about equity in the early childhood system and really figuring out how we strengthen our strategic plans using an equity lens. We're also charged with strengthening cross-sector partnerships. So again, looking at every layer of BBF's infrastructure and saying who's missing from the table and how do we build more more supportive and collaborative relationships and partnerships across sectors. We will also be really engaging our VCAP committees in discussions around how we advance equitable access to services for kids and families. And you'll see that start to come through our recommendations, but really looking to this group to be focused in on equitable access to services, resources, and supports for children alongside the Early Learning and Development Committee to figure out how we do this better in the next 5 years. As I already mentioned, we'll be developing that early childhood baseline budget. And as a part of that initiative, we are going to restart the Early Childhood Investment Committee and really be looking for a robust group of partners to come together to be moving that work forward. And then under our both statutory mandate, our mission, really focusing on how we're aligning and integrating data systems and making that data publicly accessible. Next slide. All right. So I'm going to wrap this section with the role of the Child Outcomes Accountability Team in this kind of what to expect in the next year, and then also do a very quick opportunity for folks to ask questions. And I have not been monitoring the chat, which I've seen explode in the last couple of minutes too. So the first piece is to continue to serve as the advisor. So similar to the Act Early and the AUCD grant, really being that state team that's monitoring and serving as the accountability infrastructure for this HRSA grant for the next 5 years. This group will also support the identification of key indicators and monitoring our strategic plan, specifically around goal 1 of the VCAP, all children have a healthy start. I also see this group being able to play a really important role around mapping the early childhood system. So again, we've done quite a bit of work under the Aligning Early Childhood and Medicaid to list all of the different programs, resources and support that Medicaid touches for kids and families, but building out the full map of all of the different partners, resources and support in the early childhood system, who's in charge, what ages they serve, how much funding is allocated to them so that we can actually build this out and look at where we have some alignment, where we have duplication, and where we have gaps. Again, this committee is going to be critical around how we are thinking about equitable access to services, and then also identifying the partners that are not currently at this table but need to be. So I want to quickly pull down the screen share just to say, I know that was quite a bit of information. This is just a very quick first pass at the overview of this grant, and we'll keep talking about it over the course of the year, but want folks to have the opportunity to ask a couple of questions. Go ahead, Renee.
I'm just curious, Morgan, when you talk about mapping and bringing in the consultant, are we actually talking about like mapping with GIS, or are we talking about a more linear, because I'm curious, and I'm starting to like dabble with the ArcGIS software now, and I found that like mapping in a very visual way is helpful. So I was just curious if we're talking about actual visual mapping, or if it's more like text and flow charts and layouts and that sort of thing.
So the ultimate goal would be to do both, but the priority in year one is the text version. Can we take all of everything that touches kids and families in the early childhood system, the who's who of early childhood, which has been done before by partners at Let's Grow Kids, BBF, and a range of different partners, but can we put that all in one place? And then the next step would be, can we actually do that kind of network analysis / GIS to say, not only is this what the map looks like for kids and families across the state, but here's what it looks like within regions, and where there's actually really strong lines of communication and connection, here's where we're seeing those breaks. Cynthia.
Hi, Morgan. And you partially answered my question. Thanks. I was just curious about when you're talking also, this goes hand in hand with mapping, I think, to Renee's question, but also with new partners. We're working on a potential GIS mapping around child nutrition and security. And so would that be something that we would want to link? Okay. I'm seeing your head nod. It's a project that we haven't quite secured everything we need to do, and it would be ready probably by next May. But hopefully that would fit into this project, and it would potentially bring in partners. So this goes to the partner side of my question, not necessarily from maternal child health, but from our health department, looking at chronic disease, obesity prevention. Okay, I'm seeing head nods. Thanks.
Yeah, absolutely. And, again, I think that what we try to remind folks of is that when we're talking about early childhood, we're not just talking about childcare and education. We really see this as a comprehensive systems of support. So what are all of the different components that touch kids and families in this early childhood system? How can we map, each of the different departments, programs, services, partners in the system? What is their discrete role? Who's overseeing it? Who's funding it? How much funding goes there, right? Like actually creating that. Where is it in the state of Vermont? And maybe this may get a little aggressive and I should slow my roll a little bit, but really excited about seeing like, where are the successes? Where are the challenges? Where is there duplication across some of those programs and resources? And that includes even, documenting our advocacy partners, our early childhood philanthropic funders, right? Like where are we seeing all of the different resources allocated to kids and families, and how do we talk about those different components? It's a great question. Go ahead, Jen.
Hello. I just want to say it's really exciting about this grant approval, and just wondering what's appropriate to share with families and like Families and Communities Committee at this time.
Oh, such a good question. And Jen, you're on my list of let's talk about this grant and the Families and Communities Committee role and your role in terms of being able to support the grant and really focusing on how we support leadership opportunities for kids and families. What we're trying to do right now is develop a formal press release and then the 1 to 2 pager on the grant so that we can have all of the partners know that this is an initiative that we're starting. And we're doing that in collaboration with VDH. We were waiting to see whether or not we needed formal approval from JFO, our joint fiscal partners. And we have full approval to not only start the grant, but to be communicating about it. So that's what we're working out right now is what do people need to know? At what level of kind of detail do people want to hear about it now? And how do we describe the discrete roles of who's involved in the project over the course of the next 5 years and how people can be involved in that project? I think one of the key pieces about this is that it is a systems level grant. So it is really not about direct service, although in our typical Vermont fashion, we tried to build in a little bit of that so that we can continue to support some of the direct service components of the role. That being said, it really is about the highest level. How are we strengthening the infrastructure of maternal and child health and early childhood so that at the end of 5 years, we have aligned strategic plans. There's aligned visioning. We have this map of the system. We understand the discrete roles. We understand where there's intentional overlap in programs, where there's a reduction of duplication needed, those types of things. So great question. And as soon as we have kind of more concrete language to provide out, we can absolutely be coming out to committees to talk more about it. Any other questions at this point about the grant?
I would just piggyback on what Jen is saying about like thinking about families. I think because it is a systems level grant, it is important for us to think about like what's the benefit or the positive change that families will see on the ground as a result of this work, and to get really concrete about that and then take that to message out to families like me and like just my parent role, like how will any work in this area benefit me, right, and benefit my kids? So which can be hard to translate down from that systems work, but I think it is so worth it to be able to tell like, oh, well, integration and this and this, that all sounds great. How is this going to benefit me and my family and other families within my community?
Absolutely. I completely agree. And I think that that's not even just specific to this grant. That's what we as a BBF network need to figure out and more formally operationalize, right? How do we describe the importance of the work to all of our different stakeholders and really have them be able to see their role and the importance of that role? Awesome. Go ahead, Charlotte.
I just wanted to echo what Renee said, absolutely. And then kind of reiterate what Pam said in the chat. How will families see the influence of their voices, ideas as this move forward? And it sort of, Pam's question kind of, there's a lot of synergy with my question too around, you had, I'm just curious about, are there opportunities also to think about, the system of how we integrate family voices into these conversations. So again, this might not be the exact right forum to discuss that, but I would, I would love to have a conversation with you. I'm sure Pam would as well around like, let's talk about the system of how we're integrating family voices into this so that, as Renee said, families have strong input, and then families who aren't part of these conversations have there's strong messaging around how this will benefit them.
Yes. So Charlotte, that is exactly the intent of this overall systems grant, especially as it relates to kids and families, is how do we, the Child Outcomes Accountability Team, identify the partners that need to be involved in that exact conversation for how we do a better job with family engagement and leadership and providing the right opportunities for marginalized voices, for those that are most vulnerable, who are the experts, who are the groups that already do this well, because it's not that we are trying to say that BBF will take on these different components. It's bringing those right partners together to make sure that we have a cohesive system that does that work well. Because we recognize that right now we don't. We have really critical, discrete partners who are doing amazing work. And what is the opportunity to bring all of those pieces together to do the work better?
Yeah, and I think being connected closely too to CIS, and I know that Hillary co-chairs families and communities with Jen, but I know that Hillary over the past year or two has really held and championed this vision of what does family engagement look like and elevating family voice look like for that smaller bucket of the CIS and the interagency VICC. So that's an acronym that always gets me. But I know that Hillary is just like pouring her heart and her brain into that work too. So again, how do we leverage, how do we align, and really make sure that we're doing this all kind of in unison as much as possible?
Absolutely. Amy, go ahead.
There we go. Just trying to unmute. So we have a new
I think we lost Amy for just a second, although I am envious that she's outside right now.
director of resilience development, I think, or resilience building. Does anyone know her title? What's her title, Renee?
Trauma prevention and
Trauma-
resiliency development.
Ah, God, I will never remember. All right. Anyway, although I always think the resilience piece should go first in that title, but so her name is Kea Gaguli, and I don't know if you folks have met her, but I am really impressed with her. She doesn't hesitate to say, I'm a great trainer. I'm involved with a lot of affinity groups, etc. She will put right out there what she brings to the table. I have no doubt that whatever she says, she brings. And I think she could be a great asset to this project and this group potentially as we move forward. So I just wanted to say that.
Absolutely. And Amy, I believe Beth has had direct connection with Kea so far. So we are, there are a range of partners, and we probably should have put this up in a slide deck of all of the different partners that we envisioned being a part of this grant. It is very vast in terms of, who's involved. We've also talked with the executive director of that racial equity office and the Beth, I'm going to forget the name. I believe her name is Andrea Brett, but she is overseeing the racial equity panel for the state of Vermont. So we've been having conversations with those folks to figure out how we engage them. And that will come in when we talk about some of the recommendations that may come from this committee in the next year, but also falling under this grant. And Pam, I'm seeing you post a couple of questions in the chat, and that is the exact work of this HRSA grant, is determining exactly how we engage diverse families in this work, and how do we bring the right partners together to even identify what that looks like, and then how do we implement it over the next 5 years. So we have not put we didn't put forth a formal plan for exactly what that looks like, but we identified partners that needed to be at the table to develop that strategy over the next 5 years, working with Jen and others in the Families and Communities Committee, but then really seeing this Child Outcomes Accountability Team as the group that has the expertise to know who we need to bring into the table to have that conversation. Great question, Scott, around connection to Vermont's chapter of AAP. We have been communicating specifically with partners at the Vermont Child Health Improvement Program and listed the Vermont chapter of AAP as a key partner in this initiative as we move forward. So it's not something that we've developed the formal collaboration or lines of communication for what this will look like over the course of the grant, but they were listed as a key partner. And yes, Susanna Davis is on the list too. All right, I'm recognizing that we only have about 30 minutes left, and I made that up, Beth. Do we actually have 30 minutes to talk about recommendations still?
We go until 10:30. So
Okay.
yeah. So I think we should switch gears, and folks should know that we will be talking about this more in the next year as we get it off the ground. So really appreciate the interest. And that really indicates people's investment in the changes that we hope to make. So thank you. I'm trying to capture the chat bar and the questions so that we can bring those back to you as we are able to bring in other partners. So thank you. So what I'd like to do is just really briefly, the next piece that we want to talk about is policy recommendations. So how many of you were joined us for the July Vermont Early Childhood Action Plan Summit? It was the SAC meeting at the end of July. Great. So for those of you who joined that meeting, thank you. Developing policy recommendations is truly work of our whole network. Because it's our formal process to be able to hear where the gaps and the needs are from the whole network, both regional councils and VCAP committees, and bring that to the State Advisory Council to then kind of workshop those ideas and then develop policy recommendations. And so this group's work and partners really helped us really identify that, the chronic inequities in the early childhood system were one significant gap and need of several, right? But what we're trying to do is prioritize what are the needs to develop policy recommendations to bring to the State Advisory Council this as we're kind of coming to the end of the calendar year. And so just quickly on the process is that there were 5 categories of recommendations that we brought to that VCAP committees essentially brought to the summit. We broke into small groups, and thank you to the small group leaders and BBF team members who helped facilitate those discussions, really trying to say, okay, so this is what we heard, gathering your input, and then stepped back to be able to take those notes and be able to start to draft policy recommendations. I'm kind of trying to be as brief as possible because we have limited time. So essentially specific to this group, last year's recommendations did not include a focus on early childhood education or supports for the most vulnerable children and families. And we identified that was a need to build out this year. So we've adapted the broader category and the language that you see that will pull up sides is recognize and address chronic inequities in the early childhood system. So during those small groups, we asked participants to identify successes, gaps, challenges, barriers, and then existing VCAP strategies that we are using to address those needs. So with that, there's been, I think the point is there's been quite a bit of process to this point, right? And what we're trying to do is kind of do a checkpoint to say, are we headed in the right direction and what are your priorities? So I'm going to pull up the slide that will share 4 recommendations, draft recommendations, and Morgan will talk us through those. And to the extent that we have time, get some input on where you think we should be focusing our energy.
Awesome. So I think that the best approach to take right now is to give you 1 minute to just read the 4 recommendations on the screen. And then I will talk you through the intent behind some of these recommendations and what we've pulled as information and potential kind of strategies under these recommendations. But the goal coming out of today's session is to identify 2. So we've drafted 4 based on the feedback that we received at the VCAP summit and over the course of the year. And we need to narrow it down to 2. So I'm going to pause for 1 minute and let folks read what's on the screen right now. And then I'll walk you through in detail what each of those mean. Okay, I can imagine that there are so many questions about what falls within these buckets. So what I'd like to do is, Beth, if you want to go to the next slide, I will walk folks through recommendation 1 and talk a little bit about this, and then I'll pause for questions and feedback, and we'll go through each of them like that. And then at the end, hopefully have some time for folks to be able to reflect on what they think the top 2 needs are. So the first recommendation is really about recommitting to the guiding principles. So Vermont has very clearly established guiding principles. It's something that we as a state have committed to, especially for our early childhood system. There's been considerable work done on trying to operationalize and think through these and develop strategies. That being said, there is a ton of variability in how folks use the guiding principles when. So this bucket as a priority could be operationalized in the recommendations in a range of different ways. One way would be what you're seeing in purple at the bottom of the screen, is actually taking 2 components of what is listed in Vermont's guiding principles and actually saying that we as a state need to commit to those 2 in this next year, and require, or recommend that folks are thinking about how to actually use these guiding principles in a range of their work. Another opportunity would be, going back to the top of this bulleted list, convening a group of stakeholders to actually develop and monitor a strategic plan for how we even more formally operationalize Vermont guiding principles. And in talking with some of our partners at the Agency of Education, I believe there has been existing work on this. Camille Collette possibly leading some of that initial work. So there's work to build on. A couple other opportunities are actually making recommendations for how our divisions, departments, and programs are using and promoting the guiding principles, whether it's public posting and talking more about those guiding principles. Another opportunity could be that we start requiring at BBF and through our state agency partners for folks who are applying for funding to actually have their scopes of work mapped to the guiding principles, and really be talking about how they're using this equity lens and the guiding principles in reviewing their policies and the programs that they're standing up. And then another opportunity may be to actually review each of the different laws and initiatives that are coming from our legislative partners and how they are using the guiding principles when they're thinking about early childhood and Vermont's commitment to including each and every child in their family. So I'm going to pause, and I'd love to hear folks' just overall reflections on the guiding principles and this bucket of recommendations. Such a great question, Danielle. So for folks who are looking or may not be looking at the chat, have the guiding principles been crosswalked with an equity lens? And I wish Kate Rogers was on, because I believe that there has been quite a bit of work done to do that. What has not been done that will be done under the HRSA grant, and you'll see this when we get to recommendation 4, is taking the Vermont guiding principles and looking at the racial equity office's 46, I made up that number, but I think there are about 46 recommendations that they've made this year, and seeing where there are opportunities to align, integrate what we have with the existing guiding principles and the recommendations from the Racial Equity Office.
And I would say that the guiding principles were built with an equity lens. It's just the operationalization that is needed at this point.
Yeah, and this is Danielle. I also wonder if it might be important at this juncture to be explicit in any messaging or outreach we do that is the case. Even if there is a minor update to the document that lists, that shares out the guiding principles, to say that explicitly, just because of where we're at in our development around this conversation as a state.
Yeah, that's important, Danielle. I really appreciate you bringing that up. And I think that there was an effort, but this conversation is telling me we need to make more of an effort around clear communication around the guiding principles. Under the preschool development grant in year 1, there was a focus on promoting the guiding principles, talking about equity in Vermont's early childhood system, and a range of resources produced. And it does seem like it's time to put those resources back out and be talking about them more broadly. Other questions about this recommendation bucket or thoughts around things that might be missing in some of the bullets? And then we'll move to the next one. I want to make sure that folks hear each of the 4 different buckets of recommendations and then have the opportunity to think a little bit more about narrowing to two buckets. Okay, let's go on to the next recommendation. So one of the very clear areas of recommendation that came through the small groups at the VCAP summit was around early multi-tiered system of supports. So there was a lot of discussion around provider coaching, interventions, workforce, and the importance of early childhood educators in supporting early multi-tiered systems of support, and making sure that we are actually using our data and evidence that we have about early multi-tiered systems of support to inform how to move forward. So what you're seeing as a potential second recommendation is to fully fund and implement early multi-tiered systems of support to Fidelity statewide and monitor and evaluate equitable access and outcomes for kids. So again, for those of you who were not involved in our discussion at the small group, we talked a little bit about the challenge that we're facing in supporting the mental health of children and families, but also suspension and expulsion, and really seeing that early multi-tiered systems of support is a primary strategy already listed in Vermont's early childhood strategic plan to address so many components of the challenges that we're facing in the early childhood system. And we're really excited to see this come out as a potential recommendation based on the overall commitment to early MTSS in the state. So any questions, comments about, I'm seeing the chat go wild a little bit, which is exciting. What are folks thinking about this recommendation bucket? Go ahead, Renee.
I love this. I will put that out there. Big proponent. We have invested in this in pieces for years. I guess my question, and I realize it might be a little bit backwards because I realize I'm within the child development division, but I just think that I'm curious about the conversations that have been had, or maybe they haven't, or what your plan is for those conversations. Because I also feel in order for this to happen, it really does take division and agency leadership to do that, particularly around the coaching. And I just feel like because of the conversations I've been in and thinking about the system, like the child development division recognizes that coaching and mentoring is where we want to go, but we're not quite there yet. And so because that coaching piece is so integral to this, I love it and I want us to do it, but I think it's also really dependent on making sure that we have strong commitment from the child development division leadership to really focus on building out the coaching and the mentoring portions of it within the current Northern Lights system. So I don't know if there was a question and a comment kind of all wrapped up in there, but this is great. I just think it's going to also require a big lift with partners within child development division to make sure that that coaching piece can be created.
Right. And not just the child development division, right? This is actually a cross agency, cross department, cross division initiative that we have talked about for years at the early childhood interagency coordinating team as a primary approach. And this is something that we've never been able to actually implement to Fidelity. We haven't been able to do it statewide. We have pockets where we've implemented it. We have pockets where it's working incredibly well. And what's the next step? So I agree, Renee. It is not just about the State Advisory Council potentially making a recommendation. It does take cross-sector partnership. Go ahead, Cheryl.
Morgan, this is Michelle from the Agency of Education. The other concern that we have is that programs are requesting restraint training because of Act 35. And that's a huge concern.
Thanks, Michelle. Yeah, this recommendation bucket is very broad. And as we're thinking about, making very concrete recommendations, we also have to talk about the why it matters
Mhm.
section. And that's something that we're looking for this group to help support. What are the concrete, why does this matter? What are the major concerns and barriers, and what should we be thinking about? And what do leaders across the state need to know in order to move this recommendation forward? Go ahead, Cheryl.
I just, similar to what you had said, Morgan, about the early childhood interagency coordinating team, we have some new folks who have shifted seats, but the way time goes, it probably was a couple of years ago now that we all really strongly committed across our sister departments and with the Agency of Education that we wanted to support early MTSS. And there was quite a bit of discussion and that led to us all feeling like this was a good direction to go. So it does seem like revisiting that at ECICT will be important to make sure we're all up to date with the current folks that are a part of that.
Thanks, Cheryl. Linda.
Hi, sorry I was late, but do we have good data on expulsion and suspension? Because I hear that it's a problem all the time and I don't feel that in Addison County. In fact, I feel like programs down here almost go to the extreme to support these families to where we lose good teachers. I just lost 2 good teachers because we had 2 really difficult children that we maintained their enrollment at the detriment to our program and our teachers. And so I just am curious about that data because I hear that it's a problem. And for me, when we talk about, I think this is a great recommendation, but for me, when we talk about expulsion and suspension, it goes more to how early special education services are being provided to 3, 4, and 5-year-olds in private programs, and how we are supported and how, quite frankly, we're not supported. And I think that is more of a bigger issue for programs right now than anything.
So Linda, that is the exact question that everyone on this call should be asking. So I'm really glad that you asked it around suspension and expulsion data, and that early multi-tiered systems of support is not the only thing that we need to be thinking about when we're thinking about suspension and expulsion, equitable access to services, and how we support early childhood educators, early childhood special educators. So what I can say about the data is that BBF, specifically myself and our research and data director, Dora Levinson, have been meeting with the Agency of Education data team to talk about what data exists and put together a data brief that will likely come out at the same time as the Howard Vermont's Young Children and Families report to give the most updated information and data on suspension and expulsions for our youngest kids and families. It will also talk about the major limitations associated with that data. And what we know about anecdotal and qualitative stories, as well as different ways that we wouldn't necessarily think to monitor suspension and expulsion. So for example, if we have only 5 kids that are formally considered suspended or expelled in the pre-K realm, we can't talk about that as a statewide trend. But what do we know about other case rates? What do we know about families being asked to leave programs for certain reasons? And how do we talk about that data as well? So I think we have a challenge around data in suspension and expulsion. We are going to be putting out a data brief on that, and it will be published alongside or within the Howard Vermont's Young Children and Families. And I think that, watching the chat as well, there are a range of different components that we as a group need to be talking about over the course of the next year to make sure that we're not just focusing on one, that it really is a system that needs to support our early childhood educators and kids and families.
Yeah, I think the only place that we report that we have to report that now is through Universal Pre-K.
Exactly.
I think it would be reported, or, we would have conversations with our subsidy, our people, like in Addison, Demina Noonan, if we asked a family to leave, we would be having conversations with them. And sometimes if a family's asked to leave, sometimes it's not about the child, sometimes it's about the family. And so I think when we're collecting data, we need to, all the different reasons why a program might ask a child or a family to leave is important, because sometimes it's not about the child, it is about the family.
Right.
I can tell that there's a lot of energy on this topic, which indicates its priority perhaps. And I wonder if just given time, if we should move on to the other two, but definitely note how much more discussion is needed on this topic.
Amy, go ahead. Amy, I see that. Yep, go ahead. You're still up.
I know it's taking a while for some reason. I hope you can see me and hear me now. So please accept this as a slightly unformed thought. When we were doing the work with the Children's Equity Project from ASU around multi-tiered systems of support, early MTSS, as well as around the guiding principles, I'm recalling, and I'm gonna have to find my notes, but an interesting conversation that I had with the folks in the Children's Equity Project, that she brought up a slightly different idea for me, which was, she talked about how early MTSS, if Vermont wanted to be a state that was truly committed to equity, that we would want to do exactly what this recommendation says, which is to scale and spread early MTSS. But the question she posed, and this is just what I wanted to throw out there, and I don't remember exactly what it was, but the sense of it was, you will find though, as you do this, that implementation of early MTSS the equity of implementation may differ in practice in different classrooms. And she asked me at that point, do you know if early MTSS, when it was developed in Vermont, if it was developed in concert with the guiding principles and with an equity lens? And I'll leave it there, but it was a really interesting conversation and something for us to think about.
Thank you, Amy. And is that documented in any of the resources that were just put out in the last few months from that project? And we can follow up.
Certainly go back to Lisa Gordon and ask her a little bit. She said, call me anytime, kind of thing.
Beautiful. So
yeah.
So I appreciate you bringing that to this group. And I think what we're hearing in just the two recommendations that we've outlined right now is that we as a committee need to spend some time on these topics over the next year, not just make the recommendation, but how are we as a team actually diving into some of these topics and the data around the topics. So for the sake of time, I want to go on to the next recommendation. And this one is interesting and a little bit controversial that we're bringing to the group. So for most of you, I believe you know that under H171, Building Bright Futures was tasked with leading Vermont's child care and early childhood education systems analysis. We are in the process of onboarding a national contractor, and we are doing quite a bit of work to develop the accountability infrastructure for that project for this next year, but that there will be a report coming in at the end of June and by July 1, 2022, that really talks about our early childhood system and will focus on equitable access to services for kids and families. What does our actual organizational infrastructure for both programs and state government look like? How is it addressing the needs of kids and families? Where do we have gaps? And what are some concrete recommendations for how to move this work forward? So there has been a recommendation drafted that we're looking for feedback on around maintaining the existing infrastructure and programs that are in place to support children and families until this report is released in 2022. And I think what's really important for this team to know is that we are not saying that we don't want to make progress in identifying the barriers and challenges with our existing programs and services. And we do want to be improving how we are doing that work, but we really want to be maintaining the original intent of those programs and supporting them. So what you're seeing is a couple of examples of programs that we know are either highly controversial across the state in terms of having high quality data to support how we provide those services, outcomes for kids and families, that we may struggle with data in terms of understanding the impact of the law or the program, or that we struggle to fund as an early childhood system. So some of the ways that we've outlined components of this recommendation may be to maintain the intent and functioning of CIS while identifying key challenges and barriers and developing strategies to address those challenges in this next year, continuing to fund and support programs like special accommodations grants, and continuing to make progress on Act 166, universal pre-kindergarten education, but really using an equity lens to evaluate that law. So talking about pre-K tuition, actually defining quality standards, measures of fidelity, measuring the impact of these different programs, the capacity of programs, as we're thinking about equitable access to kids and families. Thanks, Amy. I know there are 2 Amy's that are hopping off right now. So please follow up with us with email feedback. And we're also happy to check in with folks about recommendations, recognizing that folks will have to start jumping off. Questions and comments about this recommendation?
Morgan, this is Cynthia, and my question might be slightly broader. I think in my head, I'm trying to juggle this concept around equity and being for all. And some of the proposals are really focused in it seemingly on subpopulation. And so I'm just trying to figure out through this grant and through this process, is there, so you're shaking your head, you're kind of knowing where I'm going. Like, is there a balance that you're looking for that this grant requires? If we have to narrow this down to 2, this is just weighing on my mind as I'm thinking about this process moving forward.
So 2 thoughts coming to my mind. The first is that the recommendations that we're going through right now are the recommendations that will go to the State Advisory Council for formal adoption for the next year. So this is what we, as a State Advisory Council network, regional councils, VCAP committees, and the State Advisory Council will walk into the legislature, to the governor's office, and to our administration partners, as well as us as members of this system, and say, we know that this is what will make change for kids and families in this next year, and this is how we want to move that forward. That is in some ways separate from the grant opportunity under HRSA, the VIP3 project, where we are really talking about equitable access for all children and families and using this equity lens. What we're seeing in this recommendation bucket is really focused on subpopulations of children, because we are knowing that the legislature, our agency partners, and all of us have really strong feelings, perspectives, and data that support and are important to talk about when it comes to children's integrated services, special accommodations grants, universal pre-K, although those are just 3. There are many, many additional programs. So I apologize if we're kind of doing too many things at once to try and do this for the sake of time, to talk about the HRSA grant and then separately the State Advisory Council recommendations. Did that help?
Nope. Yeah, that was super helpful. I think in my mind, I might have been combining them more than they needed to be combined. So great, that was perfect. Thank you.
Perfect. Go ahead, Cheryl.
So funny. I just saw Danielle's comment and Pam's. So I also wonder about the word maintain, because I think maintain means we stay static. And I don't think anything in our system is static. Like, we always need to be thinking about how we best do this and resource it appropriately, as Pam said. So I do, and I always hesitate to, like, without concrete solution. So I don't know the exact word, but I do think of, I just want to make sure the language is more dynamic, so that we're all thinking through this, looking at data. How do we resource this? How do we make sure that we all are thinking about how we make this best for the delivery to children and families?
Thank you, Cheryl and Pam. And this is exactly what we need from this team today and over the course of the next week, is as you're reading through these recommendations, how do we strengthen the language? How do we make sure it actually meets what we are intending to say as we're thinking about how to improve our system? Because I completely agree, maintain does does kind of imply this stagnation. And we all know that that's not where we are right now. We are in the process of visioning how we improve our system. So what does that look like? And Danielle, thank you for your comment around the kind of vulnerability it takes to even write this on a slide for all of you this morning. We at BBF are really trying to sit in a space of hosting really challenging conversations, recognizing that there are a lot of perspectives, but that we want you all to sit in this with us, to be vulnerable, to have the challenging conversations, to really figure out how we do this work better. And it is not just today that will bring this to this group. But again, over the course of this year, these are the topics that we want this group to be thinking through. And in some cases, collaborating with the Early Learning and Development Committee, who may also be taking this up. All right. So for the sake of time, I do want to transition to one more recommendation. And again, we'll follow up and send all of this information to you all so you can provide some written feedback as well. And thank you, Jen, for some language suggestions. So the fourth recommendation is around reviewing and integrating the recommendations made by the Racial Equity Task Force across the early childhood and maternal and child health systems. And so this is something that I think that we've talked about over the course of both the grant and the recommendations. And Cynthia, this is where this connection is really strong. This recommendation is something that will happen and take place over the course of this next year, regardless of whether or not the State Advisory Council promotes it as a formal recommendation. So if that helps you all to be thinking about narrowing to 2 concrete recommendations, wanting you to know that this will happen, but it's really around partnership with the Racial Equity Task Force around making sure that we as a BBF network and that our legislative and state agency partners are also looking at how we take those recommendations, how do we align them with the guiding principles, and how do we review them in the context of updating our strategic plans and the work of our programs. Any thoughts around this recommendation bucket? I completely agree, Pam. And it's interesting because we actually transitioned the entire overarching recommendation bucket from a focus on racial equity to equity more broadly, recognizing that we were missing parts of it last year and the recommendations were too broad for us to actually see what we need to and want to in terms of concrete change. Okay, so we have 3 minutes left. And I think what I'd like to do is, I know we don't have a poll set up, but Beth put the slide back up of those top 4 recommendations. We've now walked through them. And we would love to.
Yeah, I thought about building a poll, but I think if people can just indicate the numbers, if it's 1 and 2 or 1 and 3, whatever, your top 2 that you, right, in the chat bar, then I will capture that.
And as you're doing that, I do want to just let folks know that I did talk with our partners at the Agency of Education and just want to draw a very clear line between recommendations 1 and 2, that, when we're talking about early multi-tiered systems of support, that there really is a direct relationship with the guiding principles.
Thank you for the feedback.
Awesome. All right. It seems like there's some pretty strong consensus around recommendations 2 and 3, and figuring out how we could potentially integrate 1 with 2. Although I would say that in some ways we're going to align 1 with 4 as well. So I think that's great. We will make some changes. We'll send this information back out to this committee. And then work on fleshing out the full one pager for this to come to the State Advisory Council recommendation. So some of the things that you can expect from us that we really want your feedback on. If you think about a one pager for each bucket of recommendations, our 2 recommendations would be here, but what I want from this group is not only help supporting the actual language around the recommendations, but what is the why it matters? What do people need to know about the why that's critical for them to understand what needs to happen with the recommendations? And then just a reminder that we don't want recommendations solely published in the Howard Vermont's Young Children and Families Report and then not used. So we want them to be used by all of our partners on this call. We want them to be useful and used by our families, our advocacy partners walking into the legislature and really figuring out how we move the work forward. So really appreciate having time with all of you this morning, connecting personally, but then also really having some solid work on recommendations.
Thank you all. And a reminder that our September meeting, we will meet in with a joint meeting with the Early Learning and Development Committee. And there'll be a presentation by our UVM research colleagues who provided the PIES report and the EMTSS report. So that will be recorded if you cannot attend, but that'll be September 9th. And then we will cancel our regular COAT meeting at the end of the month. So just, you'll see that come through on your calendar.
Thank you all. This is how we love to spend our Thursday morning too.
Yes, great to see you. Take care.